Burt mentions this in his Physiological Metromedica. Ferrum met is contraindicated where there is a condition of plethora. When there is excessive hemorrhage, excessive plethora, ferrum met is contraindicated. So ferrum met is indicated for cases of pseudoplethora. He is pale, he is anemic, but when there is any emotion or exertion, there is flushing or redness of the skin. So that is pseudoplethora. So where there is active plethora, where the face is really red and flushed, that's more belladonna, that's more aconite. But ferrum met is contraindicated because ferrum met is anemic. But obviously ferrum met is a hemorrhagic medicine. There can be hemorrhagic features which results in anemia. But if you consider plethora as a manifestation, ferrum met is contraindicated. Ferrum met is indicated for anemic cases. Ferrum met is indicated for cases where there is pseudoplethora. It gets flushed on pain, emotion or exertion. So you see, Burt mentions when there is a condition of plethora, it is contraindicated. When there is a hemorrhage or tendency to suspect atheromatous condition of the cerebral vessels. So obviously you have to understand here, there can be external hemorrhage. Ferrum met is a hemorrhagic medicine. There can be excessive bleeding, but internal hemorrhages are not so much in ferrum met because there is a tendency for anemia in Ferrum metallicum. Dunham mentions this in his discussion of Pulsatilla, that Pulsatilla is always thirstless. If the patient is thirsty, that is a contraindication for Pulsatilla, mentioned by Dunham. So whenever you are considering Pulsatilla and the patient is extremely thirsty, remember perhaps that is not where Pulsatilla is needed. Pulsatilla is generally associated with thirstlessness. Kent mentions sometimes in fevers the patient can be thirsty, but mostly in chronic cases you need to give Pulsatilla to a thirstless patient. Hale mentions this for Galium app, contraindicated in atonic or torpid urinary disorders. Many times there are two areas where Galium can be prescribed. Galium is a wonderful tongue cancer medicine, oral cancer medicine. When there are nodules in the tongue, nodulated tumors of the tongue, the patient is unable to speak because of the nodules. Galium can be prescribed in such cases. And the second area of Galium app is it can be prescribed for cases of cystitis, dysuria. For there is a lot of difficult urination, bladder spasms are there which is causing dysuria. But that's why Hale says that whenever there is atonic conditions of the bladder, there is no spasms of the bladder, Galium is not indicated. So for Galium to be prescribed, there should be bladder spasms, there should be dysuria, which helps to prescribe a Galium app. H.C. Allen mentions this in his keynotes, that Mercurius is rarely indicated in the tongue is dry. Mercurius tongue is always moist. Mercurius tongue is always salivating. I shared with you already another contraindication for Mercurius. Mercurius skin should never be dry. Mercurius tongue should also never be dry. So if a dry tongue is there, if the dry skin is there, it is a contraindication for Mercurius. Mercurius skin is constantly moist. Mercurius tongue is constantly moist and salivating. So dry tongue is a contraindication for Mercurius. Oric mentions this in his 12 tissue remedies for MagPhos. Whenever you are prescribing Magnesia phosphorica, if for any pain, better by warmth is a very important feature. So when you come across cases where the patient is better from cold, that is a contraindication for Mercurius. So contraindication is amelioration by cold. Warm application always relieves, especially dry warmth. Remember, for MagPhos, 3 modalities for any pains: better by warmth, better by pressure, better by massage. Right-sided pains, which are better by warmth, better by pressure, better by massage. If you have better by cold, it is definitely not MagPhos. It is contraindicated for Magnesia phosphorica. Farrington mentions this for Gelsemium. Gelsemium is indicated in colds of mild winter. Colds of violent winter, like very cold, very chilly, it's biting cold, aconite, belladonna is indicated. So if you see here, what's Farrington's approach or ideology? Violent colds, the temperature is really low, violent winter, resulting in violent onset of symptoms, aconite and belladonna. Comes very suddenly, comes very violently, comes very quickly, aconite, belladonna, in colds of violent winter. So very biting cold, it's very chilly, you need a lot of layers. But mild colds, mild winters require Gelsemium, where the symptoms come very slowly, gradually, insidiously. So sudden and violent onset, aconite and belladonna. In which weather? In colds of violent winter, very crisp biting cold. Gradual onset of symptoms, Gelsemium. In which weather? In colds of mild winter. So, it's not very cold, it's mild, chilly, but it's pleasant, but you get a cold and it comes on very slowly and gradually, you need a Gelsemium. So, remember, Bryonia, Gelsemium are for cases where there is insidious onset of symptoms. Aconite, Belladonna are for cases where there is violent onset of symptoms. And remember, in between, it is Ferrum phos. Ferrum phos stands midway between the sthenic activity of Aconite and Belladonna and the asthenic sluggishness of Gelsemium. Boric is first line. I repeat again, Ferrum phos stands between the sthenic activity of Aconite and Belladonna. So, the strength, the super fast express of Aconite and Belladonna, and the asthenic sluggishness and the torpidity of Gelsemium and the slowness of Gelsemium, Ferrum phos stands midway. But in case of Gelsemium, colds of mild winter, and it is followed by a mild cold which comes gradually and slowly. Guernsey mentions this for Aconite. Jerking and twitching and unconsciousness contraindicate Aconite. If you have cases where there is a lot of jerking, twitching, twitches, chorea, perhaps Aconite is not indicated in such cases, because in all of its proving symptoms, jerking and twitching were not observed for Aconitum. So, unconsciousness also contraindicates Aconite. Aconite is more often in the restless, tossing, agonizing state with the mental restlessness and the fear of death. Danger zones in homeopathy by K.D. Kanodia. He mentions about quite a few interesting clinical tips for contraindication. Sickle cord. When you come across a case of uterine hemorrhage with albuminuria, so patient is having renal hypertension where there is albuminuria, along with that there is uterine hemorrhage, that combination is a strict no for sickle cord. You see, it's, Alan mentions, is likely to bring on convulsions, so it should not be used. So, lot of menstrual bleeding in a patient with renal hypertension who is having, or chronic kidney disease who is having albuminuria, that combination does not augur well for sickle cord. You should not use it in such cases, even can bring on convulsions. Apis smell in a case of threatened miscarriage, threatened abortion. If you see in your repertories for threatened abortion in the 3rd month, apis is well indicated. But Copperwith mentions it should be used very cautiously in the first few months of pregnancy. In low potencies, it can cause miscarriage. So, if you are using apis, use a 30C, use a 200C, but too low potencies, 3C, 6C, if you are using it in the first few months of pregnancy, Copperwith mentions it can cause miscarriage. So, although apis is a medicine for threatened abortion with that, weepy, irritable temperament, but it's always better to avoid apis in the first few months of pregnancy in low potencies, which can cause miscarriage. Tyler mentions for phosphorus. Phosphorus is a great tubercular medicine. Phosphorus is a great hemorrhagic medicine. But in a case of active tuberculosis, if you're using a 1m or 10m phosphorus, you should not use it. It is contraindicated in high potencies in patients with advanced phthisis as it may start profuse hemorrhage, profuse bleeding. We have to understand that there's a lot of pathology in the lungs. There's fibrosis in the lungs perhaps. There is active tuberculosis, and if you're using a high potency, it may not suit the patient, it may be too high for the patient. Violent reaction, it may start a hemoptysis. So, although phosphorus is a hemorrhagic medicine, it has a tubercular background with the oppression in the chest, but high potencies in active tuberculosis can cause bleeding with phosphorus. Farrington mentions for Pulsatilla for a loose cuff, you should not use it. Many times it can tighten a cuff without curing it. So, you should be careful with Pulsatilla for a loose cuff, and Farrington mentions that. But I will be emphasize on sickle, hemorrhage plus albuminuria, apis first few months of pregnancy, even if there is threatened abortion, can cause miscarriage if used in low potencies, and phosphorus in advanced tuberculosis, do not use it in high potencies. And that's important with Canodia. Our last part of this feature is Essential Features by T.P. Pascheiro. Pascheiro was a famous Argentinian homeopath who was a classical homeopath, and he has mentioned some very interesting directives which I like to share with. Ambergris. If there is no premature senility, premature old age, memory is gradually declining, intellectual and physical decline, with lot of apathy, if these features are not there, it is not Ambergris. Ambergris is a remedy who is worn out, who has premature old age, who has worked a lot, overworked, that has resulted in a lot of debility, his memory has been low, he has apathy, that's when ambrogesia is indicated. So if these features are not there, it is a contraindication for ambrogesia. Ambrogesia, remember my friends, read it from Kent's Metromedica, it's a combination of natramure and phosphoric acid. Argentum nitricum, stage fright, anticipatory anxiety before in the engagement. If these features are not there, it is a contraindication for argentum nitricum. So stage fright, anticipatory anxiety has to be there. Sometimes that results in nervous diarrhea for argentum nitricum in a hasty, hurried individual. Similarly with arsenicum, in an individual who is untidy, totally cluttered, arsenicum is contraindicated. For arsenicum to be prescribed, he should be very fastidious and tidy. Herring calls arsenicum as a gold-headed cane patient, walking with a stick with a gold head, and that kind of fastidiousness oozes out from arsenicum, and he wants to keep his environment tidy to ward off any chances of infection. So if no infections, no fear of incurable disease, he is absolutely in an infection-free environment. Again with aurum metallicum, destructive aggressiveness, suicidal melancholy, if these features are not there, aurum is contraindicated. You need destructiveness because it's a top syphilitic remedy. You need suicidal thoughts because it's a top syphilitic remedy, so as to prescribe aurum metallicum. Calcarea carbonica. Remember, Farrington says this in his discussion of calcarea carb. When you have all the fears under the sun, if a patient comes and tells you, I have fear of everything, fear of darkness, fear of dogs, fear of thunderstorm, fear of heights, fear of disease, fear of animals, remember you need a calcarea in such a case. So when a patient comes and tells you, and Pastero corroborates with that, if a patient comes and tells you, I don't have fear of anything, I don't have anxiety of anything, calcarea is contraindicated. Calcarea carb is always an anxious, fearful constitution because it is Hahnemann's trio of antisoric, and Sora has all the fears under the sun. Calicarb, to an individual who is not afraid of loneliness. So if a patient is not afraid of loneliness, it is not calicarb. Calicarb needs support, needs company, needs emotional bond to keep him going. So he needs people around him, he needs support around him. Although he may be very rigid, dogmatic, his mind rules over the heart, but still he needs that emotional support around him so as to progress in life. So an individual who is not afraid of loneliness is definitely not calicarb. He is afraid of loneliness. He needs people. His fear of being alone in calicarb. So that's an important factor. And it's more about the bond and emotional support which calicarb needs. Lachesis, antisocial, non-communicative woman who does not converse very much, is not loquacious, not jealous, is not lachesis. You have the answer in that sentence itself. Lachesis has to be loquacious, lachesis has to be jealous, lachesis has to be a social, communicative woman who is talking and constantly moving from one subject to another, and that is where you need lachesis. Lycopodium, lot of self-confidence, not a coward, always going on ahead without any thoughts of consequence, that is not lycopodium. Lycopodium is a hesitant starter. You will think 10 times before starting any activity, any engagement. Low self-confidence, gradually as he progresses he gains confidence, and then he finishes with an applause. He is a coward, he is always very cautious. Remember, Lycopodium is cautious and miser. So he will do a lot of research and book the cheapest yet the safest flight. So coward, very cautious, very careful, low confidence, hesitant starter, gradually gain confidence. So you come across someone who has absolute confidence and not a coward, it is not Lycopodium. Medurinum, to someone who is not in a hurry all the time and has a good memory. You see, so both are against Medurinum. Medurinum is always in a hurry, very hasty, like argentum nitricum, and he is very forgetful, even forgets the name of his friends, forgets the name of his family members. So memory is very poor, and patient is always very hasty, very hurried, always trying to accomplish everything very quickly. And if both are not there, it is a contraindication for Medurinum. With natramure, again, if you read the sentence so wonderfully constructed by Pastero, to someone who does not feel mortified, humiliated, unfairly treated, or who seeks the friendliness, consolation, cuddling of phosphorus, natramure is contraindicated. Natramure is introverted, exact diametrically opposite of phosphorus. Phosphorus wants the friendliness, phosphorus wants the consolation, phosphorus wants the cuddling. Natramure, leave me alone. Cry in the corner of the room, sulk alone, and consolation aggravates always for Natramure. Remember, N.M. Chaudhary mentions this for Natramure. Never do a charitable thing as offering consolation to the grieved soul of Natramure. Natramure does not like consolation. There's always a bitterness inside. The more you console them, the more worse they become. So they will weep when alone. Music will make them better, but they don't want consolation, friendliness. And slightest humiliation, slightest unfair treatment will provoke them because they're very sensitive. Remember, natrum maintains the balance in the body, natrums and sodium. So they're very sensitive to any humiliation, any unfair treatment, and they get affected by it. They dwell on it for a very long time. It's very difficult for them to get over it. Nitric acid, a patient who is not ill-tempered, not angry, irascible, it is not nitric acid. For nitric acid to be prescribed, you need a very violent temper, irritable, abusive, cursing and swearing, like fire is coming out from the mouth. So if he is this kind of a face, this is not nitric acid. He is not very nice, he is not nice, he is not calm, lot of anger, lot of irritability, but cursing and swearing, abusive, accusive, that you will find with nitric acid. Platina, if you do not have superiority, you do not have haughtiness, it is not platina. Platina has to be haughty and superior. If this picture is sorinum, this is not sorinum. Why? Because full of hope, full of communication, full of optimism, which you see in her face, that is definitely not sorinum. Sorinum is always indicating the opposite, hopelessness. Sorinum is indicated where there is pessimism. One of your topmost pessimistic medicines, causticum, sorinum, or metallicum, are your top pessimistic medicines. Feels abandoned, feels isolated, the looks on the dark side of everything, feels everything will go wrong, and that is sorinum. So if you have the optimism of her face, if you have the positivity, the hope in her face, many times you have to think again twice before you think of sorinum. So from a physical point of view, if you do not have offensive discharges, it is not sorinum. From an emotional point of view, if you do not have hopelessness, if you do not have pessimism, it is not sorinum. Sepia, to a woman satisfied and happy with a home and a family, or a man satisfied with his work. It's a very nutshell of explanation for sepia. Sepia is always indifferent, looking on, feeling that her life is caught in a stasis. There is no movement in her life. She feels she is stuck in that routine of life. So with that indifference comes on lots of irritability. Read Margaret Tyler for sepia and you'll see that the child is playing with the spoons and waiting for dinner, and mother says, do hell with it, you should take the spoon and throw it, because that indifference is intermingled with irritability, taking care of the household chores day in, day out. It's like a same routine being stuck in that stasis. So she is never satisfied and happy with her home. She is indifferent, she is irritable, she does not have a smile in her face to greet her husband. So this will definitely not always be sepia. With thuya, obsessive ideas, hallucinations, anxieties, lots of ducking and hiding, trying to always deceive others, trick others, that you will find with thuya. Lots of OCDs, checking and rechecking. It's a psychotic medicine. So there will be the psychotic checking and rechecking because of the suspiciousness, and that many times will guide you towards thuya. Tuberculinum has to be stubborn, has to be obstinate, has to be headstrong, has to be irritable. No child, food, no. Go out, no. Drinks, no. No to everything. Very stubborn, very obstinate. So if this child is not stubborn, not obstinate, not irritable, is definitely not tuberculinum. Even with the irritability can be destructive, breaks things, and that you will find with tuberculinum. So Pastero gives a symptom complex. These are all the discussions of Pastero, gives a symptom complex. If these 2 or 3 features are not there, it is contraindicated. N.M. Chaudhary, Herring, Borike mentions 1 or 2 singular symptoms, but Pastero mentions the symptom complex. These features are not there, it is not this remedy. So I think that's also a good way of looking at contraindications. So many times when you are studying a polycrest, try to highlight that this is the contraindication and this is not there. Perhaps this remedy is not indicated, although it may not have a spectrum of symptoms. So again, with homage to a Master Hahnemann, such was the versatility of his understanding. He on one hand gave importance to totality of symptoms, but on the other hand he gave importance to striking singular symptoms. If these are not there, that remedy is contraindicated. Thank you.